Hi, I'm Dr. Martin. In this video, I will talk about the anatomy and physiology of the heart, a vital organ that pumps the blood throughout the body. Heart is located in the mediastinum of the thoracic cavity. It lays down above the diaphragm and located behind the sternum in front of the thoracic vertebral column and located between two lungs. Its size is about a clenched fist and weighted is about 250 to 300 grams. In this X-ray, you can see that a human heart is not vertically located, but it's laid down on the diaphragm itself. And as you see in this picture, the tip toe of the heart we call apex. It looks to the left and left side and a little bit towards the down inferiorly, and we call apex. And the big side, the big blood vessels that take out, we call this area base, as I draw and labeled for you in this PowerPoint. And you see there is a yellow vertical line in the middle of the body of this person. So that is a mid-sagittal line. And the heart center is located about 1.5 centimeter to the left of the mid-sagittal plane. So heart is not exactly in the center, but it's towards the left side. You can revisit this slide or this part again after we talked about the chambers and structures of the heart, to see when you look at an X-ray what you really see it, what is the normal. If there is an abnormality, you can go get an idea what chamber or what structure has the problem. The heart wall has three distinctive layers, from inmost to outmost: endocardium, myocardium, and epicardium. The heart has an inner lining called endocardium, which is made up with this simple squamous epithelial tissue just lined on a connective layer. The thickest muscular layer is in the middle, we call myocardium, formed by cardiac muscle that we will talk histology in next slide. The thickness of the myocardium throughout the heart varies. Atria is thinner than ventricle because most of the blood they pass to ventricle due to the gravity and requires little muscle contraction from the atria. Right and left side of the heart pumps the same volume of blood per cardiac beat, but the pressure in the left side of the heart are around 5 times higher than the right. When you think of it, the right ventricle pumps the blood close by organ lungs, but left ventricle has to pump in high pressure to deliver the blood to entire body. The heart is enclosed in a membranous sac we call pericardium, which protects it and prevents it from overexpanding or anchor the heart inside the thorax. The pericardium is attached to the diaphragm and inner surface of the sternum and is made up of one fibrous pericardium composed of a loosely fitting but dense layer of connective tissue, and serous pericardium or epicardium composed of the parietal and visceral layers. A film of serous fluid between the fibrous and serous pericardium that allows them to glide smoothly against each other. When we look in this slide, you can see the pericardial cavity. It's like a balloon, and like when you put your fist into the slightly blown balloon, you will create two layers, right? And whatever the layer is attached to the heart itself, organ itself, or to your hand, we call visceral pericardium. Whatever the outside layer that cover the mediastinum, we call the parietal pericardium. Between them we have pericardial cavity, and inside we have small serous fluid we will call pericardial fluid. it should be clear, and it should not be any blood, or it should not be higher volumes. When we focus in the histology of the myocardium, I know that myocardium contracts rhythmically and autonomously, so involuntary. Just to remember the characteristic, the cardiac muscle from the HMP1, it was semi-striated, but not as much as skeletal muscle. It's short, branched muscle cells with one nucleus in the middle, with distinguishing histological feature we call intercalated discs, which formed by the populated gap junctions between the muscle cells. Bird and mammals, including humans, have fully septated four-chambered heart. When you look the comparative anatomy, frogs and reptiles have three-chambered, two atria and one ventricle, except the crocodilians, alligators and crocodiles, they have four-chambered heart like humans as well. Okay, let's go to the human heart again. The human has four-chambered hearts and two small chambers on the superiorly located we call atrium or plural atria, and two larger chambers below we call ventricle. In the right side and left side separated from each other with a bundle of muscular tissue. The atria receive blood returning to the heart. Right atrium, which symbolized with the RA, takes blood from the superior vena cava, which collects the venous blood from the head, upper extremities, and the upper body, and inferior vena cava collects the venous blood from the lower extremities and lower trunk, and lastly the coronary sinus, which returns the venous blood of heart itself. Left atrium, however, collects the most oxygenated or oxygen richest blood from the lungs via four pulmonary veins. Notice, although veins are the ones return the blood to the heart, but pulmonary veins carry the oxygen rich blood, as an exception of the general rule that veins carry oxygen poor blood. Right and left ventricles receive blood from the atria, which pass through the atrioventricular valves, and right ventricle pumps the oxygen poor blood into the lungs, and left ventricle pumps the oxygen rich blood the rest of the body. Right atrium and right ventricle are separated by the tricuspid valve, which has three leaflets. That's why tricuspid, because the leaflets look like a cusp. The tricuspid valve allows deoxygenated blood to move from the right atrium into the right ventricle. From the right ventricle, blood has to pass through the pulmonary valve, which is at the beginning or opening of the pulmonary trunk, to allow the deoxygenated blood enter to lungs. So right side of the heart we have tricuspid valve between atrium and ventricle, and between right ventricle and pulmonary trunk we have pulmonary valves. On the left side of the heart, which is totally separated with interatrial and interventricular septae, on the left side of the heart, oxygenated blood from the lungs enter the left atrium from the pulmonary vein. The oxygenated blood returns the heart, returns the left atrium, and left atrium is separated from the left ventricle by the bicuspid, or more commonly mitral valve, and it has two leaflets, and blood flows through this valve into the left ventricle. Then it has to pass through the aortic valve into the aorta, so the aorta can transport the oxygenated blood throughout the body. So heart valves, we have four of them. Two of them is like a half moon shape. We call them semilunar valves. They are aortic valve and pulmonary valve. They are at the beginning of the big blood vessels, aorta and pulmonary trunk. Atrioventricular valves, that like the name on it, they are between atrium and ventricle. Mitral has bicusp shape, that means there's two cusps, and tricuspid valves located on the right side between right atrium and right ventricle and has three cusps. When working correctly, the cardiac valves ensure that one-way system of blood flow. They have projections, cusps, held in place by strong tendons we call chordae tendineae, attached to the inner walls of the heart by small papillary muscles, which is shown here, chordae tendineae with the number 1 on the right side and papillary muscle with number 2. You can see in heart dissection module chordae tendineae and papillary muscles as well. Blood vessels that are related with the heart. As you see, I have 6 different names written. Aortic and pulmonary veins are color coded with the red because they are the one carrying the oxygen-rich blood. However, pulmonary trunk, which labeled with number 9, pulmonary arteries labeled with 11, and vena cava superior, it labeled with the 13, and vena cava inferior, it doesn't show up here in this, but and you can see in the next slide, and they are all carrying the oxygen poor blood. And aorta, although it's not labeled in this picture, but you can see the largest artery in our body. It's red color and takes out from the left ventricle of the heart itself. And pulmonary veins labeled with the number 10 in this picture, and there's 4 of them. They return, 2 of them return from the right, 2 of them from the left lungs, return the oxygen-rich blood to the left atrium. Again, in this picture, you can see the aorta with the number 11 ascending portion, number 12 is arc portion, and number 19 is the descending portion of the aorta. You can see it, and just a tiny picture in here and the right side of the picture. In the bottom you see the blue color coded vessels we call inferior vena cava. Above we have superior vena cava. You can see behind the heart, and there is trachea with the number 21, and esophagus number 20, and descending aorta number 19, located just behind the heart. Myocardium is a highly active layer and requires rich blood supply. This demand supplied by 2 arteries, left coronary artery and right coronary artery. They are the first 2 branches that branch out from the aorta itself. They lie on the epicardium and penetrate the myocardium to supply the oxygen-rich blood to the heart. The left coronary artery runs toward the left side of the heart, divided into 2 branches. Left anterior descending artery, which is you can see in front of the lay down in front of the interventricular septum, and left circumflex artery turns to the left back of the left side. The left coronary artery distributes blood to the left side of the heart, left atrium and ventricle, and interventricular septum itself. The right coronary artery, on the other hand, runs down the right side of the heart, divided into the marginal artery in the lateral part of the right hand side of the heart, and posterior descending artery, supplying the posterior part of the heart. The right coronary artery proceeds along the coronary sulcus and distributes blood to the right atrium, portions of the both ventricles, and the heart conduction system. I want to emphasize this heart conduction system. Okay, now interruption of the coronary circulation may cause heart muscle to starve for oxygen. We call this ischemia. And if it continues, it causes the myocardial damage or death of the myocardial tissue. We will call this myocardial infarction, or we call heart attack. Coronary veins, on the other hand, follow a course similar to that the coronary arteries return the venous blood to the heart. The coronary sinus is a collection of coronary veins. Two-thirds of the cardiac venous blood is returned to the heart via the coronary sinus. They open the right atrium, while the one-third return directly into the heart. The chamber of the heart contracts and relaxes in a coordinated fashion. The contraction phase is referred to as systole, and the relaxation phase, when the heart fills up again, as diastole. One complete cycle of these events is referred to as cardiac cycle. Under normal conditions, electrical activity is spontaneously generated by the sinoatrial node. We call this the cardiac pacemaker. So primary pacemaker for the heart we call sinoatrial node or SA node. This electrical impulse is propagated throughout the right atrium and left atrium. The conduction of the electrical impulses throughout the atrial depolarization, it will be seen in EKG as the P wave. As the electrical activity is spreading throughout the atria, it travels via specialized pathways known as internodal tracts from the sinoatrial node to the AV node. The AV node functions as a critical delay in the conduction system. Without this delay, the atria and ventricles would contract at the same time, and blood wouldn't flow effectively from the atria to the ventricles. The delay in the AV node forms much of the PR segment on the EKG, and part of the atrial repolarization can be represented by the PR segment. The distal portion of the AV node is known as the bundle of His. The bundle of His splits into two branches in the interventricular septum, the left bundle branch and right bundle branch. The two bundle branches taper out to produce numerous Purkinje fibers, which stimulate individual groups of myocardial cells to contract. You can see an example of an EKG, and we have an electrical line, as you see here, and some waves above this line, some wave goes below this line. And when you, as you can see, P, R, and T are positive waves, and Q and S are the negative waves. The P represent the time that atrial depolarization. That means the sinoatrial node started the electrical activity as a pacemaker, primary pacemaker, and the electrical activity started and dividing or distributing to the two atria. The PR segment or PR interval is representing the delay in the AV node, and QRS, this complex, representing the ventricular myocardium, ventricular depolarization, or ventricular contraction. Now, the repolarization of the ventricles, it is the restoring of the resting state. In the EKG, repolarization of the ventricle induces the T waves. A resting heart that beats slower than 60 beats per minute or faster than 100 beats per minute is regarded as having an arrhythmia, because it is out of the rhythm, right? It's not the good rhythm. It's something abnormal. Normally, our heartbeat normally beats 72 beats per minute, but it can be standing between 60 and 100. So any heartbeat between 60 and 100 we call normal in a resting state. if the patient is resting and then have a heartbeat between 60 and 100, it's normal. However, if it is below the 60 beats per minute, it's known as bradycardia, and a heartbeat faster than 100 is known as tachycardia. If the sinoatrial node fails to initialize, the AV junction can take over as the main pacemaker of the heart. We call this secondary pacemaker. AV node has a regular rate of 40 to 60 per beat per minute. These junctional rhythms are characterized by a missing or inverted P wave. So in EKG, if you see a missing P or inverted P, that means it might be a junctional rhythm, that sinoatrial node is not working. The normal arterial blood pressure is 120 over 80 millimeter mercury. And we use a tool to measure the blood pressure, we call sphygmomanometer. When we measure blood pressure 120 to 80, 120 represents the systolic blood pressure. And when we measure the 80, that 120 over 80, 80 represent the diastolic blood pressure. And differences between 120 minus 80 or systolic minus diastolic blood pressure represent the pulse pressure, which is in this example, as a normal person, it is 40 millimeter mercury. Systolic pressure less than 90 millimeter mercury is considered as hypotension, and systolic blood pressure over 140 millimeter mercury considered as hypertension. As we learn throughout this video, the right side and left side of the heart separated with a band of tissue we call the septum. So they separated, they work separately. And right atrium is the place that collects all the oxygen poor blood. Superior vena cava brings the oxygen poor blood of the head, neck, upper torso, and the upper limbs, upper extremities. And lower or inferior vena cava collects the lower extremities and lower trunks, poor oxygenated blood. And coronary sinus returns to right atrium the 2/3 of the heart deoxygenated blood. And after they collected in the right atrium, they had to pass the valve called tricuspid valve to the blood enter the right ventricle. That's the reason most of the time the first blood valve or heart valve that damaged in the heroin addicts is the tricuspid valve, because it's the most infected blood or toxic blood is first touched to tricuspid valve. Okay. After this information, between right atrium and right ventricle, we have tricuspid valve. So blood collected in the right atrium, passed through the tricuspid valve, went to the right ventricle. Through right ventricle, it goes to the pulmonary trunk and pulmonary arteries. Until that moment, we have all the oxygenated blood in this picture, symbolized with the blue color coded. After the oxygenization happened, the gas exchange happened between atmospheric air and capillaries of the lung, and oxygen-rich blood, pure oxygen-rich blood, has to return to the heart itself. They return to the left atrium. Left atrium, to able to turn the left atrium, they need to come via pulmonary veins. We have 4 pulmonary veins, 2 on the right, 2 on the left. So the oxygen-rich blood return to heart, the left atrium. From the left atrium, it has to pass to the left ventricle. So it has to pass a valve we will call bicuspid or mitral valve. After left ventricle, with the contraction of left ventricle, oxygen-rich blood has to pass the aortic valve and pass the aorta via aorta, it distributed to entire body. And notice when the blood passed through from right ventricle to pulmonary trunk, it has to pass another valve we call the pulmonary valve. So that is the direction of the blood flow in and out of the heart, and all the anatomy student must know this related with the heart. I wanted to mention one more thing, which is the embryologic remnant we call the ligamentum arteriosum. Ductus arteriosus is a blood vessel in the developing fetus, connecting the trunk of pulmonary artery to the proximal descending aorta. It allows most of the blood from the right ventricle to bypass the fetus's fluid-filled, non-functioning lungs. Upon closure at birth with the first breath of the baby, newborn baby, it becomes the ligamentum arteriosum. So it's symbolized here in this model with the number 12. And you can see how fetal heart circulation little differ from the newborn heart. You see the ductus arteriosus is open in fetal, and newborn heart ductus arteriosus will be closed, and by time it will be turned to a ligamentum instead of a passageway of blood. Again, you can see another model in our lab and the part of the heart in this graphic. I hope you enjoy it. Please feel free to give me a feedback by liking, subscribing, or leaving a comment below. Have a good day.